this muscle, I want you to turn this off. Just relax into my hand.
Off.
Like, drop your head. There you go. See? Camera, you saw that? This was very activated. Now it's not. Okay? So, there, I'm going to take my contact on that right side. Hi, Darlene.
Hi.
It's really good to see you again.
Yeah.
It's been a hot minute. Darlene and I are actually old friends. We used to go to elementary school together, like Heritage Glen Public School in Oakville, Ontario. And since then, we kind of kept in touch on and off. We went to the same high school, then we became gym buddies in undergrad, and now she's a patient. So she described earlier off camera that everything is, I believe, effed. That's kind of how she described it. But I'm going to let her talk about exactly what she means by that. So, Dar, why don't you introduce yourself a little bit here?
Hi, everyone. Darlene here. You could just assume every joint is not so great. My neck I can crack just very casually. Shoulders will pop every once in a while. Spine pops. I can like crack my lower back. Hips have not been good in years. So just like from the crown to the hips, not so great.
All right, so not doing too well. I know that you live a very active lifestyle, though, right? Again, you used to play rugby, I believe, in varsity undergrad.
Yep.
Rugby, and then I know that you hit the weight room quite regularly, and you also do Brazilian Jiu-Jitsu. So, are you still doing? I know you're still weight training. I know you're still doing BJJ. Is there anything else that you're doing that's kind of aggravating it, or what is it about those things that you find aggravating?
Well, I also sit at a desk all day.
You also, right,
So
what do you do for a living too?
Yeah, my job isn't so great with sitting down all day, but also having people trying to break me on a regular basis in jiu-jitsu is not helping at all.
It seems like they might be winning a little bit.
They might be winning. Don't tell them that, though.
No, they don't need to know. This is totally doctor-patient confidential, except for all the people who watch it on the internet. They don't need to know. That's fine. Okay, you mentioned that you were kind of getting crunched to on one side with the BJJ. Was that one side in particular, or just kind of a generic?
I think it's both sides, actually.
Okay.
So what happened is like my lower body will go one way, my upper body will go the other way, and so it's an involuntary adjustment that I don't like happening very often.
So you're not a fan of that. Let's see. I'm curious as to how it would feel if it's done in more of a therapeutic way than I'm trying to take this person down to the ground.
Yeah.
Right? That would be interesting to see. Have you seen a chiropractor before? I think you mentioned maybe once briefly.
Yeah, one time. They did do that little adjustment going both ways once.
Yeah.
Not bad.
You liked it?
It wasn't bad.
Okay, good. Okay, we'll take not bad. We'll take didn't hate it, absolutely. Any other complaints you said? So basically, just to summarize, neck, upper back, hips, lower back, all of it's kind of messy. You sit a lot at work, and then you get up and you go do these physically intensive hobbies that you have, which I'm not advising against. Physically active hobbies are the best hobbies, in my opinion.
With also very little warm-ups.
With very little warm-up. So that's just the thing. Unfortunately, we're very close to 30, which to some people watching may not seem very old, but to us feels old. So we're going to have to probably look into some potential mobility stuff, especially for the hips. So for today, we're going to physically examine you, see what we can find, and then we'll get into treatment. Probably going to look like some adjustments, some soft tissue, and also some mobility exercises. I'm thinking particularly for the hips. So,
that would help.
Any questions right off the bat, or are we good to get into the physical?
Let's get into it.
All right, let's get into it. All right, so I'm going to get you to start by bringing your chin down to your chest for me. Okay, now any stiffness kind of...
Yep.
This feels pretty stiff, actually.
Yep.
I probably didn't even have to ask that. So what I'm going to do now is I'm going to push a little bit further. Stiffness is worsened.
Yep.
Okay, good. We're going to come back up. We're going to get you to look up to the ceiling for me. How's that?
Oh, I feel that.
You feel that where?
Like right in here.
Oh, right kind of at the top you're
Yeah.
motioning there? Okay, interesting. And when I go ahead and jam that a little further, yeah, that doesn't even move anymore.
Yeah,
that feels
that's as far as I know.
still messy. Okay. Face forward. Going to get you to check your blind spot. Rotate your head to the right, please.
Oh, no.
As far as we'll go. Okay, so we're getting to about maybe 70 degrees. And now we'll go this way, left side. Okay, we'll get to 45 on this side. That's a noticeable difference. So normal range of motion for head rotation is between 80 degrees and 90 degrees. We're at 70 on this side, which I thought, okay, a little bit decreased, 45 on this side. So Darlene's earlier hypothesis of her neck being a little bit messed up, it's possible that she's correct here. We're going to get you to bring this ear down to your shoulder, please. As far as it'll go, and that's as far as we're going today. Okay, now I'm going to go ahead and see if that's true, and that's true. Okay, and we're going to go this ear to that shoulder. Okay, less on the left side. So one thing worth mentioning is that Darlene's passive range of motion, which is when she goes as far as I can and then I try to induce a little bit more movement, is pretty locked, which to me means that we're getting some bone on bone or joint action restriction. Not bone on bone, that can be mistaken for arthritis. She doesn't have arthritis, but she is quite locked up in her joints. If the joints are still fluid, we're usually able to get a little bit more passive range of motion because we're only working through stiff muscles. But I think we might have a little bit of jamming going on here, which I'm going to be happy to take care of. So next up, I am going to get you said it's lower back, middle back, it's basically everything,
yep.
right? Okay, I'm going to get you to lay on your back next, okay? You're saying low back, okay? One of the most staple, I'll crouch down a little bit so I'm in the camera here, low back examinations or orthopedic test is just called a straight leg raise. So I'm going to take this leg, you're going to just relax as much as you can. I lift it straight up and we're hitting 90 degrees. Any pain in the back with this? No? Perfect, okay? So Darlene's hips and legs, unlike her neck, actually get to the full 90 degrees. So most people can't do that, even though, again, it's the normal. So that's her right side. Let's check her left side just to confirm that that's bilateral. And good, yeah. Okay, so what's this about not doing enough mobility? Because that's actually pretty impressive that you can do that.
Hammies are okay.
Hammies are okay. All right, she pays attention to the hamstrings. I will get you, actually, no, we're going to also test for the SIs here. So for this, at thigh thrust, I'm going to bring this up. Tilt the hips. I'm going to place my hand kind of on your SI joint. That's between the sacrum, the bottom of your spine, and your hip. Okay. And then we're right here. And any discomfort with this? No? Awesome. Okay. Now we're going to do the same thing on this side. Okay. Bring this up. Hand on the SI joint and anything there.
No, there's a nice pop though.
It's a nice pop, huh? Okay. I didn't even feel that one, so there you go. That's just how good I am. Okay. So I know you were mentioning that you have some hip discomforts as well, so we're going to bring this up. We're going to test the internal rotation and the external rotation of our hips, because usually some people are asymmetrical on at least one of those or uncomfortable from one. So first off, internal, which is where more people are uncommon. Darlene's actually able to get to, I'll crouch down here, Darlene's actually able to get to 45 degrees, and you can't see this on the camera, but that's quite impressive for internal hip rotation. I think I can get maybe 15. I got some bad internal rotation. So now what we're going to do is external rotation, and I think, anything with that, or are you okay?
Yeah, it's like down here.
Down where?
It's like in there somewhere.
Okay, Darlene's pointing right to her greater trochanter area, and again, I'll bring that up on the Complete Anatomy app so that you guys can see that, but it's kind of an origination site for a whole heck of a lot of her gluteal muscles, or an insertion site rather, so that kind of makes sense there. Let's go ahead and do that on this side now, and internal rotation. 40. Ooh,
that was nice.
Hip pop. There we go. Look at that. I think the mic got that too. That's awesome. Okay, and then external rotation here. How's that? Same. Oh, that's okay. Same spot. Yeah. Okay, right in there. Okay. Once again, greater trochanteric area. So I'll show that. My hands are coming in on your back now. Okay. It's always important to say that because I don't want to scare patients. Oh, there's a little pop right there. When I'm going in for initial palpation.
That's fair enough.
Are you left or right-handed?
I'm right-handed.
You're right-handed, okay. So Darlene had greater reduction in neck range of motion to the left than she did the right, and I'm kind of trying to feel up this left shoulder region here, and I'm feeling a lot of tightness and restrictions there as well, and that kind of makes sense to me as the neck, the shoulder, and the upper back are all very connected biomechanically. If we're getting an issue with one, the other two are going to start moving in compensatory ways, which will eventually lead to their own problems down the line. So the right side, as compared, does feel a little bit messy too, but it's definitely worse on the left there. So okay, so that's the thoracic spine. We're going to come down to the lower back now. So the muscles there's a little bit of tension there, in Darlene's lower back actually don't feel too bad. They're holding in. Again, the SI joint, bottom of our spine is our sacrum, okay? Next to our sacrum is our iliacus, or our hip bones, or pelvis bones. SI joints right here. Just going to go ahead, and that's got some bounce. That's got, right side feels a little bit less bouncy than the left, so that's probably going to be a restricted right SI, but that's fine, nothing we can't handle. Going to get you to take a big breath in for me, and all the way out, all the way out. Very good.
Good stuff.
And we're going to get this left side here now. Take a breath in, and all the way out.
Yeah.
Crunchy.
It's like at the base of my head.
Yeah, that's just it. So that's kind of where your levator scapulae muscle originates from, and I'll go ahead and I'll link that, or not link that, but I'll have it slide in the top of our shoulder blade up into our neck. So, and let's do this side. Breath in, and all the way out, all the way out.
Oh yeah.
There's a real good one.
That was better.
Yeah. And there might be a little bit here. We're just going to check. Breath in, and all the way out. Nah, we already got that one. That's okay. Next up, I will get you... Do you want to do neck or low back next? I'll let you pick, actually.
Let's do low back.
Let's do low back first?
Okay.
Okay. You're in very close to the correct position. I'm actually going to get you to put your hands just like that for me, and just relax your head there, okay? I'm going to bring this leg up and scoot your hips towards me, please. Thank you. And then just relax. Awesome. Okay.
You already got a pop.
Perfect. All right, so take a breath in, and all the way out. That all just released even before I dropped. There was one big one there. That's okay. We're going to get you on your other side now, facing the wall. So, similar to the other side, we're going to take this hand, pull, just like that. Good. And breath in, and all the way out. There's one baby one hiding there. So we're going to feel up and down Dar's neck here, and interesting. So Darlene's got mild tightness at the very top. Like, how does that feel? Because
that feels nice.
That feels nice. You like that?
That's
okay.
fine. Yeah,
When we go a little bit lower down, that feels a little bit knotted on her left side, which is in line with the whole left neck range of motion being decreased. Remember that rotation and the lateral flexion? So we can probably get through to that. And also worth mentioning is that this is very much a joint issue. You can tell that because with a light pressure, the muscles themselves actually feel quite good. But once you go deeper down to the underlying joint structures, it's definitely feeling a little bit more firm, a little bit less mobile. So let's start with the right side, just because that's where the mic is set up. So MRT channel, you're probably very familiar with this. I'm using my finger to pin the muscles and stretch by moving her head. And are you ready for your first neck adjustment today then, Darlene?
Yeah, you've kind of been teasing it so far.
That's what I do. Yeah, I'm just a big tease. So what I am doing here is warming it up, basically. In chiro community or chiro lingo, there are warm and there are cold adjustments. A cold adjustment is when I just go in there and immediately go for it, which doesn't always feel great. I like to do warm adjustments. I like to warm the patient up first and then we go for it. So enough teasing. I'm going to get you to turn your head as far as you can to the left for me, please. Good. And then this muscle, I want you to turn this off. Just relax into my hand. Like, drop your head. There you go. See? Camera, you saw that? This was very activated. Now it's not. Okay. So, there, I'm going to take my contact on that right side. How was that?
Yeah, that wasn't bad.
Happy to hear it. That's perfect. Okay. So, right side feeling a lot better after that. The left side now. And now from this angle, you guys watching can see exactly the movement I'm doing with my fingers. I'm pinning the muscles nearby and then turning her head to stretch underneath my pin.
Can you feel it?
Oh, yeah. I imagine you can feel it
I
then,
can
too,
hear
if
it.
you can hear that move. So it's actually, that's not uncommon that patients can hear things within their own neck.
Like
and
the
that's
clicking?
just, yeah, the clicking, the moving, the sliding of the muscles there because it's literally inside of you. All right, so you're hearing it through something called bone conduction, which is kind of like...
Oh, I have headphones like that.
Yeah, exactly. Okay, like I would think the back of the headphone container would explain that better than I would right now. Just I'm a little bit rusty on the physics behind it, but...
Physics.
Yay, physics. Okay, so turn your head as far as you can to the right for me, please. Good, and oh, perfect. So you shut that right off. You learn quick. Okay, so we take the contact. Okay, that one's being a little bit more stubborn. One moment. I'm going to move the camera a little bit more so you can see that. Okay. Turn once again. Relax that. Good.
Oh.
But that one was a little bit more challenging to get, but we got it.
That was a deep one.
Yeah, it was. Trying to make you a little bit taller with this one.
Oh, hell yeah. Do
You're
it.
welcome. How tall you want to be? 6 feet?
Oh, hell yeah.
All right, 3, 2, 1. No.
I was like, are we doing this?
No, we're not that kind of chiro. No. All right, good. So we've done the neck, we've done the low back, we've done the mid back. Next up, we're going to get you face down, okay? Okay, so I'm coming in now on the back, okay?
Mm-hmm.
So.
Can you do this anywhere? Or is it mostly just a back thing?
Theoretically, anywhere. Yes, we can do this kind of technique. There's actually 5 different tools, and each of them are kind of designed for different regions or areas. So, why was there a specific location? Oh, that right there. Was there a specific location that you had in mind, or?
I'm just kind of curious because, like, I feel like is it like too sensitive to do on like a joint, like a shoulder or something?
No, absolutely. So I'm actually going to be doing this on your traps, okay, muscles up here, which like a lot of people consider to be their shoulders. Mm-hmm. But we could also do like the infraspinatus right here. We can do all throughout the deltoids, like anywhere you want.
Oh, cool.
You point, we do. Obviously, it doesn't feel great if it's on like a bony prominence, right?
Okay,
but
so
like you're really supposed to use it on the muscle structures, but it can be used and beneficial everywhere.
Would that be good for shin splints though? If you're doing it on your shoulder?
Potentially, it depends if it's true shin splints or not, because shin splints is actually by definition a stress fracture, okay? And you don't want to be really irritating a fracture any more than absolutely necessary. But that being said, if it's actually just muscular strain, which a lot of people do get and it's not true shin splints, then yeah, absolutely you can do this kind of thing. Why, do you have shin splints?
I used to get them a lot.
Back in the day,
Oh yeah.
That's unfortunate.
Stupidest rehab stuff for it too.
What, like stupidest as in it was just dumb, or?
Yeah, and it's just like you're just kind of pointing your toes in a different direction.
Unfortunately, that's what the tib ant, which is the muscle that's affected for shin splints, kind of does.
Stupid.
So, yeah. Now, Darlene, usually at this point, I ask my patients a question to try to learn a little bit more about them and, kind of help the audience feel more connected to them as well. So tell us a little bit about your job, and more specifically, like what it is about your job that you find the most rewarding while I do this.
Cool.
Mm-hmm.
So I work for a conservation authority, and basically what we do is our main mission is to help businesses become more sustainable. So we focus on waste diversion and water stewardship, and so we do a bunch of educational stuff to talk about why water is important or how foodware products are ending up in our waterways.
Mm-hmm.
So we get to host some cleanups and education events, which is kind of fun. You bring the community out, clean up some water in your community. It's kind of fun.
Actually, that sounds kind of fun if the whole community's out there.
Yeah, we have one on June 11th. It's going to be really fun.
Ooh.
All the people just kind of come out. There's lots of snacks and stuff like that.
Oh, snacks. You got me. I'm there. That's what you were missing. I heard water. Water's great. Oh, snacks.
Snacks. Yeah, there's those out there. People just come together, clean up trash. It's not hard. It's just something communal to do. But we also help businesses divert their waste. So reducing greenhouse gas emissions, but also like reducing the amount of waste that they're producing. So we host a whole bunch of businesses that come together and they kind of just help each other out on how they're tracking and reducing waste. So it's really cool to see the new technologies come about, but also like them coming together and analyzing like what they could be doing better. It's cool to see businesses
Collaboration.
Actually, because like I'm a little anti. I used to be very anti kind of.
I remember.
Business kind of corporate.
You used to tell me about that actually. I don't know if you remember during our gym days or not,
probably.
but yeah.
So it's cool to see people actually interested and genuinely interested in reducing their carbon footprint.
Well, that's good.
Yeah.
I'm happy because I know that you've been a big environmentalist for a while, so I'm happy to see that you're able to work within your field.
For sure.
That.
And I didn't have to give up the water aspect. Water has always been my thing, but including the waste aspect. Like,
right, we were on swim team together too.
Yeah, we
I
were.
forgot about that. Oh, throwback.
I do. I hate swimming. I hated that, but it was cool to hang
Loves
out with
water
everyone.
but hates swimming. Okay.
Well, competitive swimming.
Fair.
Because then you just like if you get tired, you just drown. Like, sucks.
I'm glad you didn't. I'm going to roll this down just a little bit, okay? I want to get at the lower back structures there, and we're going to flip like that. Perfect, okay.
I think I still have some pictures somewhere.
Of?
Some team.
I know that I still have some pictures somewhere. Switching tools. Ooh, hit the mic accidentally. Okay, here we go. So we're starting to get a little bit of petechiae, that red splotchiness that I was telling you about beforehand, Darlene, right where I am right now.
Oh, I can already feel it.
So you can notice that feels different than the rest of the region so far, yeah?
Oh, yeah.
Good. Yeah, and camera can very easily see that right there.
That doesn't even just feel like the fascia. It feels like the muscle.
Oh no, absolutely. Your muscle's going to be stiff if your fascia is tightened up too. So, but this also, like, it's not like this exclusively works fascia, because underneath that you still have your muscles, which I'm working as well. Yes, we're holistic creatures like that. Yeah, and we're getting that petechiae all the way up into the trap region. So Dara, this looks like something you could actually probably benefit from regularly.
Probably.
Yeah. How's petitioning for benefits?
Almost. I'm almost there.
There you go. Okay. Okay, now I'm going just as hard on this other side, and it's interesting to see that we've got like almost none showing up. We have a very, very small amount there that I don't think the camera can even see, but let's see if we can get a little bit more. Yeah, there we go, but again, definitely got a bias on the left side. I might take that back in a minute here. Yeah. Yep, I'm taking that back. Okay. Now, to those watching, this might seem like an alarming amount, but truthfully, this isn't anything unusual. If you watch one of the previous treatment videos with the teacher Laura, you can see a nice before and after a month of regular treatments. This is Dar's first time having something like this done.
Like that?
Yeah, so it actually, yeah, I showed her the picture so she know what I'm talking about. But it looks very similar to that, actually, if not a little bit comparatively worse.
Oh, great,
but
thank you.
the good news is that it's nothing to be alarmed about, and I'd anticipate that you feel a lot better if we're able to keep with this regularly, which is totally up to you. But
It does already feel better.
good. Stay there a moment, I'm going to get the extra off you.
The what?
The extra, like oil or
Oh,
emollient off you.
sounds like a scary tool.
No. Yeah, the extra. Okay. All right, just yes, it is recording. Ooh, that's a spot there, eh? Ticklish?
It's just like, and it's like, nerve, it's like,
Oh, that's a tight piriformis. Tender? Yeah, just a lot. Yeah. So to those watching, there's two primary glute muscles that I try to hit when I'm using the massage gun. The first is the glute medius proper, which kind of comes around in this wing-like shape here, this curve. Then there's the piriformis connecting directly from the sacrum over to that greater trochanter we were talking about earlier. So piriformis right there, over here. And that was the one that she was sensitive on the right side there. That's one spot right there. That's so actually, yeah, sure. That spot is our TL junction where our thoracic spine becomes our lumbar spine. It can become very tight because the thoracic spine and the lumbar spine have two opposite movements. The thoracic spine is good at rotating side to side, lumbar spine is good at bending forward, bending backward, and this area needs to absorb those opposite directions, which can result in a lot of shearing, fortness, and muscle tightness as a result. So for that, yeah, I would probably maybe either stick an acu needle in there or do some kind of rotational flexion-based extension exercises. But it's not uncommon that we get a lot of tension on this particular region. Very, very common. All right, I will get you seated up next. So I'm going to start by getting you to look up and to the right for me, please.
That way?
Yep, exactly. I'm going to take a pointy elbow, put it right there, and I want you to slowly look down to the left, please. Good. Up and to the right, and slowly down to the left. So if this is too much, you let me know and I'll back off. But again, I very much have the mindset, you want to make an omelet, you got to break some eggs.
Yeah, pain is good.
Pain is gain. Up and to the right, down and to the left. Good. Up and to the right, down and to the left. Now we're going to change movements. I'm going to get you to tilt your head to the right, please. Good. And now I want you to tilt as far as you can to the left. Good. And right. Left. Ooh. And right. Left. Right and left. Awesome. Good. Okay. Now we're going to move all the hair to the other side. Just flop it on over there. Good. And up and to the left, please.
Why do I have to think about that so much?
A lot of patients get it wrong. Don't worry. If you get it right the first time, like you're very impressive already. So up to the left and down and to the right. Up and to the left. Down to the right, and up and to the left, down and to the right, up and to left, down and to right, and once again up and to left, and down and to right. Oof.
You feel that?
Yeah. Good. Now we're gonna move the hair again. We're gonna tilt to the left now, please. Good. And tilt right. Good. Left. And right. And left. And right. And left. And right. And we'll do one more. Left. And right. Good. Okay. Now, before we change positions here, I want you to just try, loosen up. I want you to try rotating your head to the left for me once again, please. As far as you can go, as far as you can go. Good. So beforehand, we were at a hard 45. Now we look like we've increased to maybe like 60, 65. Okay. Still not quite where I'd want her to be. I'd want to get her north of 80, but there's still already a significant immediate improvement in the rotation. Let's go to the right now. Let's go to the right. And that's hit full 80. So, well, not full 90, but it's hit 80, so I'm happy with the right side.
It feels like 90.
If it feels like 90, that's important too. Patient report, right? But it seems like Dar responds well to this kind of therapy off the bat here. However, like most patients, you probably need a few in order to get the sustained benefits from. But all right, so how do you feel after all that?
I feel nice. I feel lighter.
You feel lighter, eh?
Yeah, I feel like I can move a little bit more.
So obviously it's kind of what we go for anytime you're seeing a chiro or physio or massage therapist. You're trying to loosen things up more often than not because we do get really stiff with our modern day lives. I know that earlier in the opening interview, Darlene kind of mentioned how she's not doing a lot of the mobility stuff that she feels that we should be doing once we start to get close to 30 again, right? Mm-hmm. So again, it's hard to film certain mobility exercises within this room because I do have very limited space, but I'll leave links below about the exercises that I think somebody with Darlene's condition should be doing. This includes, really, again, it's largely mobility, so we're looking at hip 90-90s for hip issues. Even just going into the external rotation earlier, we got an audible pop, so I have a feeling if she was able to do that herself or to stretch that out prior to doing her squats, that would aid her quite a bit. In addition, we're looking at the thoracic spine. We could look at cat camels to really flex the extension and flexion component of it because that's very often neglected in our thoracic spine. And as well, she's been talking consistently about dead bugs. You've been doing dead bugs recently?
I'm a big fan of dead bugs now.
Okay, what is it about dead bugs that you like so much, if I can ask?
I can like literally feel it on both sides of like my low back as like I like lower my legs. Mm-hmm. And I feel like that's doing something.
You're right, it is doing something. So for low back, anytime we do have low back pain or discomfort, one of the first interventions should be increasing core stiffness or stability. And that's primarily done through, dead bugs is a phenomenal exercise for the rectus abdominis, the front. But there's also obliques and the QLs or the back muscles proper that I'd want to target as well. So for that, we could look to McGill's Big 3. You can follow the video that I'll put up in the corner there. I think that's the right corner. If it's not, then it's this one. But that's going to be side planks and possibly not modified curl-ups, bird dogs, right? So links in the description for all of those below. I'll show Darlene them off camera so that she can keep doing them herself. Otherwise, thanks for coming in today.
Yeah.
Really appreciate that. Glad you seem to respond well. Any closing thoughts for the camera and the audience, or?
No, I feel good.
Darlene's a little sleepy now, like most patients are, but still. So thank you for coming in. We can end on a high five. Boom. There it is.
Don't forget to like and subscribe.
Thank you, Darlene.